is Felicia Rose Kempter. Welcome to KHD Pediatric Webinar. Happy Halloween. This time of year, people eat a lot of candy, so we thought it'd be a good idea to do this video to teach kids how to clean their own teeth.
Thank you, Felicia. Well, everyone, this is Felicia, as you've met, and this is my 7-year-old daughter, Samantha. Felicia's 10. This is Samantha, who's 7, and this is Alexandria, who's 4. In a little while, you'll meet Jackson, who is 18 months. He's taking a nap right now. And as Felicia said, we're really excited to be able to do this video to, just give some information on what, you guys need to do around the holidays and really just all the time to keep dental decay away and to be healthy. And so we'll get into some detail on morning routine, evening routine. I do want to talk a little on pediatric sleep problems and also tongue tie problems. And we'll also, at the end of the video, give you a tour of the office. Forgot also to mention that in a little while too, we'll have Jackson do a demo on how we clean his teeth. So thanks again for watching. It should be a wonderful video in terms of education for the entire family. Okay, so we're here to do a demo of what we do prior to our day, when we first wake up, after getting ready for our day. Today's a school day, so everyone's ready for school. Quick disclaimer, we don't have at KHD any interest in any of the products that are going to be shown. Also, a quick disclaimer, there could be a lot of discussion that we did on fluoride and on different materials. We're not going to get into that today. If you have any conversation or question or comment, please contact the office. We can give you some information on that one-on-one. Really, the overview to know is that there are many different ways to keep teeth clean. And so our belief is in minimization of what goes in your mouth and actively removing what? The bugs, right, Felicia? Mm-hmm. The bugs in your mouth, because that's what grows when we don't clean the food out of our mouth well. So what we're going to do now is go through a demo of what our morning brushing routine looks like. So normally what we would do is my wife and I would have it where really they get ready once. You guys, do you brush together or sometimes together, sometimes?
Do it at different times sometimes.
Okay, that's what I thought, because it does get confusing. So for our demo today, we'll all do it together. So Felicia Rose and Samantha are, as I said, 10 and 7, and so they're at the age where we have them using a Philips Sonicare kids brush. We can show that. And Alexandria is getting ready to get her kids brush at 4. So my recommendation is before the age of 4 or 5, depending on their dexterity, the best is to just use a regular hand brush. We have a nice Crayola brush today, a purple one. So why don't you girls go ahead and, actually right before that, let's talk about types of toothpaste. These are all different toothpastes that have no fluoride, no sodium lauryl sulfate. Actually, to mention, this one does. These are all products, though, that we accept as an option to use at home. One little pointer here, this is Ozone Toothpaste. This actually, it says skin oil, but this is actually can be used as a toothpaste also. It's coconut oil and ozone. We would recommend this for kids that have cavities, active cavities, or issues with gingivitis, which would show up as gum bleeding. Oxygen or O3 with the coconut oil will actually kill the bacteria and help the gum inflammation go down. For kids that don't have gum inflammation like my girls, we have all these different options. So girls, which one do you like? I mean, this is just, so Samantha, you and Allie both like this. Show what that is.
This and this one.
You like these two. Okay. Felicia, what do you like?
This one.
You like that one too?
Jackson likes this one.
Yeah, and you've used these too. Like this is our adult, this is what Shannon and I use. But do you like this too also sometimes?
Yeah.
I think you did. So, but for today's sake, if you like this the best, go ahead and get your toothpaste. Now, do we use a little or a lot of toothpaste?
A little.
A little, right? Because we need like as much as a corn kernel. So girls, go ahead and get the toothpaste. Allie, you need some help?
I got this one.
Here.
So, I need this stool. Can I have this stool?
Yeah, that's okay.
Oh.
So, now, So when we use our Sonicares, turn so Miss Tony can see you. When we use your Sonicare, what do? You don't have to answer actually. You're going to do the front of the teeth first, and you're going to go in a circular motion. And Allie, you're going to continue doing the front teeth too. And my advice is when the fluid builds up, take the toothbrush over the sink, out of your mouth, and spit out all the fluid. So Felicia Rose is doing a good job going around just the front top teeth. And with these Sonicares, at the 30-second point, it'll beep. So now go to the back, the roof of the mouth, get those all those teeth towards the back, circular motion. And I would coach your kids as I am right now on this video. We do it this way. We have to remind them where to go. Get all the way in the back. Make sure you're getting all the way up at that gum line and get those bristles so you feel it between your teeth. Okay? Very, very, very good job, girls. So, and you know, when we're waiting on the timer, it sure feels like it's taking a long time. 2 minutes is long. So now we're doing the lower front teeth, and Felicia's a good example of someone who has some crowding. Her teeth are coming in, so she knows, go ahead and get it all the way into those grooves. Flip the brush with your other hand, remember? And get in that groove. You have to look in the mirror, go ahead. Mirrors really help. And then the last beep, we're going to go to the back teeth. Allie, you getting in the bottom there? Good. Good. And so the reason we usually do this one at a time is mom or dad goes behind and checks when the timer goes off. Very good. So in the morning we just brush. We don't floss. And we do this usually, ideally before breakfast. After breakfast we'll rinse with water and we'll go to school. Because we don't want the bugs to eat our breakfast. Is that right? Okay, almost done. Boom. Very good, girls. So let Allie up there so she can spit. And we let them... So remember, when you rinse, we want to pull the water through our teeth. Right? Very good. So... now they'll go about their day, and this evening we'll come do another video when they're getting ready for bed. Okay, so we're here with Shannon, my wife, and also my 18-month-old son, Jackson. And we're just going to go through a couple things that we do with him at 18 months old, and also just some other details about kids from his age group. So it's difficult with someone his age because it's hard to get them to open. It's also hard to get them to let you towards the back. And so I got a couple little tricks for that. Jackson's really good, so he makes it easy. I know that some people, well, some of our other kids, we had tougher times. So he's probably a good example of what an easier kid would be. So, and just to go through, here's a couple different things we use with all of our kids, or some options for products. It's okay, Jackson.
He wants his toothbrush.
That's right. Here. So actually, to start there, one of the things we do, because he knows the routine, is we give him the brush before we put any toothpaste on it, so that he can have a chance to brush and chew on it even, just get used to having it in his mouth. And so we do want brushing. Sometimes I get him started. Hey, Jackson, you do it. Oh, you want me to do it? Okay. So one of the things you can do is you can do dry brushing. And you gotta have clean hands, but if you can get underneath his lip, you can get there. So the whole thing is we want to get him started if we can. Jackson, why don't you brush? And we let him play with it. So when we're ready though, after a minute or two, you got a couple options. You can make your own toothpaste with coconut oil and baking soda. We also have some different kids toothpaste that we'll use. For today's example, we'll just use Orajel. This is something that he likes and is fluoride and sugar free. Okay, buddy. So sometimes to protect his head, what we'll do, and just to get a good view, Shannon, why don't we take him over here on Felicia's bed? We'll go ahead and let him lay down. And if we're in a rush as parents, maybe we do it quick. Hey, buddy. And then, another thing that if we're checking his mouth, we'll use a light. And I'll block his eyes if he lets me. He's ready for nap. Jackson, can we brush? Can we show everybody how we brush? We won't do the light, okay? Here, ready to open? Okay, so sometimes he'll get in the way. So, and you know, you have to, even if he does get upset, you want to get started, get your hand towards the back. It's okay. Hey, good boy. And then small circular motions, and I'm watching the bristles get kind of submerged. You don't want to dig them into the teeth, but you can do little circles. It's not hurting him. And this, you know, he can swallow, so it's not going to harm him. But going with small circular motions with the brush at about a 45-degree angle. And he doesn't have, you know, I check back here. I just rub the gums a little, even if the tooth's not in all the way. You don't dig in with pressure, just more little small circles. And usually they react really, really well, even when they're needing a nap. So once a week, I'll try my best to look with a light. A headlamp on low works really well. If you want to get really advanced, get them a small set of sunglasses. That's what we use in the office, and they usually do real well. So what are you checking for? You're looking to see if there's any object in the mouth. Good example, he fell a couple weeks ago and he bit his tongue, and there was a pretty big wound. And just for all you parents out there to know, that will heal if it stays clean. We're going to talk about ozone oil later in the video. Ozone oil is a great way to keep it disinfected. We for a few days, I would at nighttime with the light look in his mouth and put just a small dab on his tongue. And you know, you want to check for debris, for anything that is, you know, foreign object, etc. You never know. Sometimes you'll see stuff in the gums. And if you ever have any questions, you know, call your dentist. And nowadays, you know, take a cell phone picture. And I think that's really valuable. So, all right, Jackson, nap time. Thank you for being so good.
All right.
Okay, so we're here at bedtime, and you guys already saw what we would do with brushing. One comment would be after they get done brushing, the reason we do one at a time is I go back and check. Well, one of the things that we would do to check, an easier way, would be on a bed. So I always think looking in someone's mouth, it's best for them to lay down. So at night, what we do is after their brush, we'll go ahead and do our check and our floss at the same time. So first thing, when we go to do flossing, Samantha's going to be our demo. You want to get a pretty long piece. You want to get at least 12 inches or so. I think the biggest problem people have, overall, adults and kids that start flossing on their own, is how they hold it. They wrap their index fingers, and now they're handicapped with how they can move the floss. Whereas if you wrap your middle fingers lightly, what'll happen is now you have the floss held tight, and now you have both your index finger and your thumb where you can maneuver the floss and move to clean floss as you go to get the child's teeth flossed. So obviously you don't want to use the same piece of floss for different kids. You also want to wash your hands between. You know, I'm okay without wearing gloves with my kids, but I want to make sure my hands are clean. I don't want to have dirty hands to put germs in their mouth. So obvious statement. But Samantha, go ahead. Let's do a demo. Allie has a light. Oh, one comment to say. We don't have our headlamp. I can't find it. But normally we would use like a headlamp from the store, like REI. It works really well to be able to see. So Alexandria is going to help us with a cell phone, which is a second option. So lean down here, Samantha.
This thing doesn't work.
Okay, so go ahead and open nice and wide. And you keep that light right there. And what I'm going to do, we'll start with the back tooth. We get between, we click between, and we wipe both sides. It's like a C-shaped motion. We're going in, we're getting down, we're clicking. Sometimes you'll see, just because a new tooth's coming in, or there's even some gum inflammation, you'll see a little bleeding. Sorry about that, darling. Didn't mean to click that hard. So with where that tooth is getting ready to come out and where there's crowding, it's difficult to get there, so you have to be real gentle. But the action I'm doing is I'm actually wiping the sides of the teeth. I'm not trying to jam it down into the gums. So I'm just lightly getting there and getting between the teeth. Allie, can you put the light closer?
Yes.
Thank you. So you can see I'm using my thumb here. Now to get to the back, I'm using my index finger. Click in between. Click in between. Okay, Samantha, now tip your head down for me. No, down. turn a little towards me. So you see I'm making her move towards me. Put the light in her mouth, and then click. Same thing here. And there's a baby tooth here. There's 2 permanent teeth. While I'm doing this, I'll make the comment that Samantha has, like a lot of kids, crowding at age 7. This is a skeletal problem. Thank you, Samantha. You did great. This is a skeletal problem. And what I mean by that, it's the shape of her jaw, and it's how she's developed. Even though they're in the same gene pool, for different reasons, they've had different developmental aspects to their jaw. What does this factor in with? It factors in with breathing, it factors in with swallowing, it factors in with speech and chewing. It also plays a role back to the sleep, and we can tell a lot about kids who make noise at night. So this thing to know is, if you make noise at night, if a child makes noise at night regularly, a wheeze or a snore or a grunt, it could be the signs of a more serious problem, which is childhood sleep apnea. Felicia, I have sleep apnea, so our kids are predisposed to it. And Felicia, when she was 5, was making regular noise at night. We had an exam done by a sleep specialist and also an ENT, and both of them recommended that Felicia had her adenoids out. And so even as a holistic guy, and where we want to minimize with surgery, we made the decision to get the tissue removed and to allow her airway to develop correctly. Now, Samantha had plagiocephaly. Her head, because of the way she was when she was in mom's belly, was to the side somewhat. And that we had some devices when she was a child to help her head grow back to the right shape. And because of really that condition, she's developed now a bite where the teeth come together in a cross bite. And this also is part of the reason why she has the crowding that she has. So this is so common, and I bring up my kids because you're probably sitting there at home saying, oh yeah, I have this, they have this. And I want to take the right approach with my kids and with yours on how to treat it. So the most advanced way to go is Myofunctional Orthodontics, which Myofunctional Orthodontics is looking at the muscle, the bone, and also the teeth, and using their growth cycle to help get everything back in concert. It's done with a set of trays, similar to Invisalign. They wear them at night, and they also wear partially during the day. It's not a palatal expander like is done in traditional orthodontics. In some cases, that's the only option. You know, it's a case-by-case basis. I truly do believe in orthodontics with braces and palatal expansion if that's the only option. It's much worse to develop with your skeleton misaligned. And I think the real scary part when you look at health, something that I've heard over and over, is that over something like 80 to 85% of the kids that have ADHD or been diagnosed with ADHD, I won't say have because we're not sure if they really have it, they have issues with their sleep. They have clear-cut signs of pediatric obstructive sleep apnea. And so we believe that really their lack of sleep and their then combativeness and lack of paying attention during the day gets them diagnosed with attention deficit. So it's been clearly researched. So we've really looked further with our kids, both at home and at the practice, on this topic. And one other last thing to mention is about tongue ties or tethered tissue under the tongue or the lip, which can affect speech, latching as babies, and also just eating in general. This also can play a role in your health and your sleep, so we do treat that in our office also. So girls, thank you for doing this with me, and I'm sure everyone out there is thankful for you spending some time with us. Say bye, okay?
Bye.
Hope you enjoyed that pediatric webinar. Stay tuned next time for a webinar on tongue ties. We hope to see you guys soon.